I'm going to switch to another question that I want to make sure I get in. And Mr. Merritt, I'm going to direct it to you and Mr. Menahan. Last night, NBC Nightly News ran a story about an investigation which found that a wide variety of prescription drugs on certain insurance plans are actually cheaper when the consumer pays out of pocket. That makes no sense to me. We also learned that at least in some negotiations, in some contracts, there is a gag order that prevents pharmacists from telling patients that they would be better off paying out of pocket than using their health insurance. So I would like both of you to answer the question of how common is this practice and how can this occur? How can it occur that a prescription benefit manager whose very job is to negotiate prices is negotiating a price that's actually higher than the consumer would pay out of pocket? Mr. Merritt.
Yeah, it's a really good question, and to answer your question, it's not something that should be going on in the marketplace. It's an outlier behavior. I'm not even sure if it's a PBM or an insurer behavior, but it's not something that we support. We think the person who goes to the pharmacy ought to pay the lesser amount if it's a cost sharing or the cost of the drug. So if there's a generic that costs $5 and it's a $20 copay, they should pay $5. They shouldn't pay that. So I agree that it's a practice that we don't support. It's an outlier practice and a practice that we hope goes away.
Mr. Moynihan.
Thank you, Senator Collins. And first, I should say that I didn't handle an earlier question about rebates. We oppose rebates in all their forms. With regard to the question that you just asked, pharmacies are incredibly frustrated. Pharmacists are incredibly frustrated with their inability to help patients. Providing patient care shouldn't be this difficult. My members feel incredibly frustrated with their lack of connectivity, their lack of communication with plans. Essentially, they have no negotiating power, and they're sort of told what they have to do, and if they can take it or leave it. They can either be in a network or not, typically not, and if they're in the network, they're told how to perform.
So is it an outlier, as
no,
Mr.
it's not an
Merritt
outlier.
says, or is this a common
It's common.
practice? Thank you.